Well, thank you, Chair Murray and our ranking member, Senator Burr, and thank you to all of our witnesses for your testimony today and for the optimism that you have been expressing as well. I think it's much needed. I want to start with the issue of long-term care facilities. And I want to start with a question first to Dr. Shah and then to Dr. Jha. In New Hampshire, more than 70% of COVID-19 related deaths occurred within our long-term care facilities. Despite consistent pressure from me and many of my colleagues, the previous administration failed to provide the clear and consistent guidance and resources that these facilities needed to protect their residents and their staff. Secretary Shah, moving forward, what steps should we be taking to better support long-term care facilities and ensure that they are protecting their residents against COVID-19 and other infectious diseases?
Senator, thank you for that question. I will say one thing that is absolutely critical, which is that as we are continuing to prioritize populations for vaccines across the country, we cannot forget that the absolute critical importance of vaccinating seniors, those who are older in our communities, especially in long-term care facilities. As you remember, in the state of Washington, very early on in this pandemic, we had a long-term care facility where there were real issues, and that was the first, if you will, focus across the country of what we needed to do as a system to respond to the needs within those long-term care facilities. So I think it's really threefold. First of all, we have to continue with the process of vaccinations, and we need to make sure that the staff and the people, the persons who are within those facilities are vaccinated. We have to prioritize that. Fortunately, we have been, but we need to continue to prioritize that, especially as we have turnover in either staff or people. Number two is we need to make sure that we have those resources within those facilities so they also can continue to have all the protective measures, the personal protective equipment, masks and hand sanitizers, et cetera, and they have enough room to be able to cordon off individuals who are sick or have symptoms to be able to get them out of that facility or at least away from others. And number three, which is back to that additional question that I answered previously, was around behavioral health. We also have to be really thinking about the impact on seniors, on those who are in long-term care facilities by the isolation away from families, away from others who they normally would be relying on to be able to touch and feel and be a part of a family. And that is absolutely critical for us to be doing, is to make sure those resources are also there from a behavioral health standpoint as we also continue to fight the pandemic.
Thank you. Now I want to turn to Dr. Jha, because outside of congregate care settings, home health workers face unique challenges accessing paid sick leave and personal protective equipment, and many individuals who receive home-based care are struggling to access vaccines. So, Dr. Jha, what steps can we take to improve vaccine availability for workers and patients across all types of care settings, including for those who are unable to travel to centralized vaccine sites?
Yes, Senator, such an important question and a couple of components to that. I mean, first I want to talk about home health workers. These are some of our least well-paid people in our society. A lot of them are hourly in their wages. And the idea that, a lot of them have turned down the opportunity to get the vaccine, and we say, well, they're vaccine deniers or they're being hesitant. We fail to understand that these people have lives where they can't take time off if they end up having side effects. In a way that I could, when I had my vaccine shot, I could take a day off if I needed it. Many people cannot. So I think there are some really important issues about understanding the context in which people are turning down vaccinations and finding policies, as well as really having or the organizations themselves being able to pay people to take that time off or help them get vaccinated. I think that's a really important area that has not gotten enough attention, and we've been quick to dismiss these individuals who work incredibly hard, often multiple jobs, and get paid so very little. More broadly, I think right now, in terms of getting people vaccinated across the country, my take is, we really need an all of the above strategy. And I think the administration has largely been doing this right. They've got large sites, FEMA sites, That'll attract a lot of people and we'll get a lot of people through. But there are a lot of homebound individuals who can't get to these sites. And so that's why we need things like mobile clinics or mobile vans, or we need community-based organizations that know where these people are and can reach out and connect with them. So my overall thinking on this has been, we've got to let states do a lot of this, and then states have to push this out to community-based organizations who actually understand the community at large and can implement a lot of these vaccination strategies.
Well, thank you very much. And I see that I'm over time, Chair Murray, so I will submit the rest of my questions for the record. Thank you.
Thank you. Senator Marshall.